Welcome to the Deep Dive. Today we're tackling something huge in healthcare. All that unstructured text. The doctor's notes, nurse observations, path reports, even patient feedback comments.
hmm It's a staggering amount. Estimates say, up to 80% of all health data is actually in this unstructured format.
Exactly. It's packed with information, but making sense of it all, that's been the real challenge for a long time.
Well, yeah. And what's fascinating, I think, is the kind of information you find there. It's not just data points. It's the narrative, the clinical reasoning, the patient's actual experience, things that, structured data often just misses.
Totally. And that's where our main topic comes in, natural language processing, or NLP. This branch of AI is really becoming the key, isn't it, to unlocking what some people call a goldmine of medical insight.
It really is.
So our mission today in this deep dive is to get into how NLP is actually learning the language of medicine and what kind of impact this is starting to have on patient care, research, even just running hospitals day to day.
Yeah.
So maybe let's start with the why. Why has this unstructured text been so much harder to analyze than, say, data neatly organized in a database?
Okay, yeah. The basic issue is, structure, or the lack of it. Structured data, it fits into nice, neat boxes, easy for computers, unstructured text. It's free form. Think about how different doctors might write about the exact same thing.
Right. One might be super technical, another more descriptive.
Exactly. That variability in just style and wording alone is a huge hurdle for any algorithm trying to spot consistent patterns.
And it's not just the style, is it? Medical language itself is just dense. You've got all the abbreviations, SOB for shortness of breath, HO for history of.
And acronyms that can mean totally different things depending on who's writing it or what specialty they're in.
Yeah, plus all the jargon. It's complex even for humans sometimes, let alone a standard computer program.
Absolutely. Then there's the whole narrative flow of clinical notes. They tell a story over time, which is vital, but it's not like a spreadsheet. It's not easy for traditional analysis to just grab onto. And then you layer on things like negations. Patient denies chest pain. The NLP has to understand that denies means it's not present.
Ah, right. Or uncertainty, like rule out pneumonia. That's not a diagnosis. It's a possibility being considered.
Precisely. And the system needs to get that distinction right. It's subtle, but critical.
And the sheer amount of this stuff generated every single day, it's overwhelming when you think about it.
It really is. Trying to manually review all that, impossible.
So, like you said before, structured data gives us the skeleton, maybe. But this unstructured text, that's where you find the context, the nuances, the flesh and blood of the patient's story, so to speak.
That's a good way to put it. And the consequences of not being able to easily access this, they're pretty significant. Clinicians waste valuable time just searching through notes.
I bet.
And more importantly, potential insights get missed. Connections between cases, subtle patterns, early warnings. They might just be buried in the text.
So we're basically underutilizing a huge amount of collective clinical wisdom that's being documented constantly.
We absolutely are, or at least we were before NLP started making serious inroads.
Okay, perfect transition. So we see the problem. Now, let's talk NLP. Give us the overview. What exactly is NLP in this context? And what are the key tools it uses, as of now, mid-2025?
Right. So NLP, natural language processing, fundamentally, it's about teaching computers to understand and interpret human language. The goal here is to get computers to read and comprehend all that medical text, but, at a massive scale and incredible speed.
Making sense of the doctor's handwriting, essentially, but digitally and way faster?
Well, hopefully it's typed mostly now. But yes, understanding the meaning. And there are several key techniques that are really important in healthcare.
Okay, let's break this down. You mentioned one earlier named entity recognition, NER.
Yes, NER. Think of it like an intelligent highlighter. It scans the text and automatically finds and flags the important bits, the entities.
Okay, so what counts as an entity in a medical note?
Oh, lots of things. Diseases like type 2 diabetes, medications, maybe atorvastatin, symptoms like persistent cough, procedures, appendectomy, body parts, left lower lobe, even lab results like hemoglobin A1C 7.2%.
Got it. So it pulls out the key terms?
Exactly, and it categorizes them. This is often like the very first step in making sense of a clinical document.
Okay, interesting. So it identifies the nouns. What's next? Sentiment analysis. How does that apply here?
Sentiment analysis is about figuring out the emotional tone. Is the text positive, negative, or neutral? In healthcare, you might use it to analyze, say, patient feedback forms.
Ah, the comment boxes.
Right. NLP can sift through those comments and flag whether patients are generally happy about communication or maybe unhappy about wait times or just making neutral observations.
So it helps you understand the feeling behind the feedback, not just a rating.
Precisely. It gives you richer insight into the patient experience.
Okay. And then relationship extraction. Sounds like it connects the dots.
It does. It builds directly on NER. Once you've identified the entities, the medication, the disease relationship extraction figures out how they're linked. So if the note says prescribed metformin for diabetes, it identifies metformin drug and diabetes condition and understands the relationship is treatment for.
I see. Or like shortness of breath is a symptom of heart failure.
Exactly that. Yeah. Symptom of is the relationship. It's how we start building a structured understanding out of that free text.
Makes sense. Moving from words to meaning and connections. What else is in the NLP toolkit for healthcare? Text summarization.
Yeah, that one's pretty intuitive, but really powerful. Clinicians are drowning in documentation. Text summarization uses NLP to create short, concise versions of long documents, think discharge summaries or lengthy progress notes.
Just the highlight.
Essentially, yes. It pulls out the key information so a doctor can quickly get the gist without reading pages and pages. Big time saver.
I can imagine. Okay, topic modeling. That sounds a bit more abstract.
It is, but it's very useful for large amounts of text. Imagine you have thousands of patient safety reports. Topic modeling can automatically sift through all of them and discover the underlying themes or topics that keep coming up without anyone telling it what to look for beforehand.
Like finding patterns you didn't even know to search for.
Exactly. It might reveal, say, recurring issues with medication errors in the elderly or communication problems during shift changes. It surfaces hidden trends.
Fascinating. Okay, one more. You mentioned machine translation.
Right. Obviously crucial in a globalized world and with diverse patient populations. NLP-powered translation can help understand research from other countries or, importantly, communicate with patients who don't speak the same language as the provider.
But accuracy must be absolutely vital there, right?
Oh, absolutely paramount. You cannot have mistakes in clinical translation. Stakes are way too high. So while it's incredibly useful, it often needs careful validation, maybe human oversight for critical interactions.
Got it. Powerful, but needs guardrails.
Yeah.
So it's clear these techniques, often used together, are the engines driving this. How are they actually being used today? Like real-world applications in 2025. Is this stuff actually deployed?
Oh, definitely. It's moved well beyond the research lab. We're seeing real impact. Take clinical decision support, for example.
Okay.
NLP systems can scan patient records notes included almost instantly. They can then flag potential drug interactions the doctor might miss based on a newly mentioned symptom, or remind them a patient is due for a cancer screening, or even suggest potential diagnoses based on findings scattered across different notes.
Wow, so it's like an intelligent assistant constantly reading over the clinician's shoulder, but in a helpful way?
Kind of, yeah. Aiming for proactive, safer care. And speaking of safety.
Right, patient safety. How's NLP helping there?
It's a huge area. NLP can analyze incident reports, clinical notes, even patient complaints online to spot patterns of adverse events, medication errors, or infections much faster.
Faster than waiting for manual reports to filter up.
Much faster, and potentially more comprehensively. It allows hospitals to identify and address safety risks much more quickly.
That sounds incredibly valuable. What about research? Clinical trials and studies can take forever.
Yeah, NLP is a massive accelerator for clinical research. Think about pulling specific data points like comorbidities or treatment responses from thousands of records. NLP can automate a huge chunk of that data extraction.
Takes away the manual chart review nightmare.
Exactly. And it can dramatically speed up finding eligible patients for clinical trials by scanning notes for detailed criteria.
Oh, that's clever. Matching patients to trials automatically.
Plus, analyzing real-world evidence from EHRs to see how treatments work long-term in normal practice. NLP is key for that too.
Huge potential to speed up discovery. You also talked about understanding patient experiences better.
Right, going beyond just the Ratus 1 to 5 scores. By analyzing those free text comments on surveys or online reviews, NLP helps hospitals understand why patients feel the way they do.
What are the specific things they're happy or unhappy about?
Exactly. Is it communication, wait times, staff attitude?
Yeah.
You get specific, actionable themes directly from the patient's voice.
That qualitative insight must be gold for improving care.
It really is.
And what about the less glamorous side, the admin work? Billing, forms.
Still important. And yes, NLP is streamlining administrative tasks too. clinical coding, for instance. NLP can read the doctor's note and suggest the right ICD or CQT codes for billing. Saves time, improves accuracy.
Less hassle for the doctors, better for the billing cycle.
Mm-hmm. And things like prior authorization, getting insurance approval for drugs or procedures. NLP can pull the needed clinical details from the notes to help pre-fill those tedious forms.
Anything that reduces that administrative burden is welcome, I'm sure.
No doubt. It frees up time for actual patient care.
Okay, and one last application area you touched on, public health surveillance.
Yeah, this is broader. NLP can monitor things like news feeds, social media, in multiple languages even, looking for early signs of disease outbreaks, tracking public sentiment about things like vaccines, or monitoring health trends.
So it's like an early warning system using publicly available text?
It can be, yes.
Yeah.
A valuable addition to traditional surveillance methods, especially for speed.
It's really impressive, the breadth of applications, but, working with sensitive health data using complex AI, there have to be significant challenges, right?
Oh, absolutely. It's not simple plug and play. There are major hurdles. Top of the list, always, is data privacy and security.
Has to be.
We're talking about incredibly personal, sensitive information. So robust methods like de-identification, stripping out names, dates, etc., are essential. Or techniques like federated learning, where the analysis happens locally on the data without the raw data ever leaving the hospital's control. Privacy is non-negotiable.
Foundational. What else?
Then there's the huge need for rigorous validation. These models have to be accurate and reliable. You can't have an NLP tool suggesting the wrong diagnosis or missing a critical safety signal.
The consequences are too high.
Exactly. So they need extensive testing across different patient groups, different hospitals, different writing styles. Good enough isn't good enough in medicine.
Makes sense. And we talked about how complex medical language is. That's still a challenge for the tech itself.
Definitely. Handling the complexity of medical language remains a major focus. Think about distinguishing family history from a current problem, or understanding what an abbreviation means in this specific context, or just keeping up with new terms.
It requires a really deep, nuanced understanding.
It does. It needs very specialized algorithms and high-quality training data that captures all those subtleties.
And assuming you build a great, validated, privacy-preserving tool, how do you get clinicians to actually use it effectively?
Yes. Integration into clinical workflows. That's the final critical piece. The tools have to fit seamlessly into how doctors and nurses already work. They need to be easy to use.
Not another clunky system to log into.
Right. And they need to provide clear, actionable insights, not just more noise or alerts that get ignored. Usability is key for adoption.
So it's about making the technology serve the human, not the other way around.
Perfectly put.
So, given these challenges, privacy, validation, complexity, workflow, what's the path forward? How do we keep advancing responsibly?
Well, it really requires ongoing, focused R&D, specifically for medicine. Continually improving the NLP techniques, and crucially, collaboration. You need NLP developers talking to doctors, nurses, hospital administrators, ethicists, regulators. Everyone needs to be involved.
Breaking down silos.
Yes. And we need more high-quality annotated medical data to train better models while figuring out how to share or use that data safely and ethically. Standards are important here. And finally, I think fostering AI literacy among healthcare professionals themselves.
So they understand what these tools can and can't do.
Exactly. So they can use them confidently, appropriately, and critically.
It sounds like a very deliberate, multi-pronged effort is needed.
It is, but the potential payoff is enormous.
Okay, so let's wrap up this deep dive. We've gone from the challenge of all that messy, unstructured text
80%.
to the specific NLP techniques being used to make sense of it, like NER and relationship extraction.
Right, the tools in the toolkit.
And then looked at how it's actually being applied today, decision support, safety, research, patient experience.
All those real-world impacts.
What really stands out is how NLP is, like you said, unlocking the power of clinical language, turning all those narratives and notes into something we can actually learn from systematically.
Yeah, it's about finally being able to properly listen to the collective story held within millions of patient records. We can see patterns, understand nuances, and hopefully make better decisions because of it.
It feels like a major step towards a healthcare system that's not just more efficient, but potentially safer, more proactive.
And more patient-centered. By truly valuing and utilizing the detailed narrative of each person's health journey.
The language of medicine is incredibly rich, and NLP is becoming our translator, our interpreter. It's helping us understand health and disease on a much deeper level.
It's an exciting time, definitely. Lots of potential ahead.
Indeed. So let's leave our listeners with this thought. As our ability to analyze the language of care gets better and better, how might that fundamentally change the actual relationship, the interaction between you, the patient, and the doctors and nurses providing your care in the future? Something to think about. Thanks for joining us for this deep dive.